So welcome back to Literal Growing Bonds. A while back we talked about flat feet. So today I am back to talk about specifically treatment for flat foot. As a parent, it's natural to worry about the child's health and development. One of the topics that's often overlooked is foot health. So specifically today, I want to talk about flat foot, the condition where the arch of the foot collapses. So flat feet can be a concern for children because it can affect their balance, posture, and overall mobility. So if you suspect that your child might have flat feet, there are some common signs and symptoms that are often overlooked. So one of the telltale signs is the lack of an arch or a very faint arch. Often is the lack of an arch when the child is standing. Another sign could be that the foot could roll inwards when the child walks or stands. So let's talk about the current treatment for flat feet. So the treatment for flat foot depends on the severity of the condition and whether it's causing any symptoms or not. So let's look at some of the options. One is the non-surgical options. One of the options in non-surgical treatment is wearing supportive footwear. So wearing shoes with a good arch support and a cushioned sole can make a big difference. Another is use of orthotic inserts. So custom-made or over-the-counter arch supports can help distribute the pressure evenly and help improve the alignment of the foot. Third is physical therapy. So exercises that help strengthen different muscles and tendons around the foot and the leg can help improve the function and also reduce discomfort. Another option is stretching and massage. So targeted stretches for the Achilles tendon and some foot muscles can help relieve the tension and improve the flexibility of the foot Medications are also an option, so over-the-counter painkillers and anti-inflammatories can help manage that discomfort and swelling that could happen in some of these feet. So for many people, non-surgical treatment is very effective managing the symptoms and improving the quality of life. In the event that that's not improving the symptoms, then surgical treatment is an option. So surgery is typically reserved for very severe feet that don't respond to the non-operative interventions. The common procedures include things like tendon transfers. So this involves moving a tendon from one part of the foot to another to improve the arch support. Secondly, are osteotomies. So osteotomy is where the bones are cut. So the surgeon reshapes and positions the foot to correct the alignment through different cuts made in the bone. The flat foot can also be corrected through fusion surgery. So fusing joints in the foot can stabilize the arch and reduce pain in very advanced cases. Let's talk about the complications of flat foot treatment. Like any medical intervention, there's often risk for potential complications. Here are some of those you need to know. For the non-surgical options, it could be one, that there's ill-fitting orthotics that could actually cause more discomfort or worsen the symptoms the patient comes with. So it has to be fitted properly. Supportive shoes may not fully address the symptoms that are present, so that has to be looked into. Medication themselves have side effects, especially if it's used for a long time. What about the complications as a result of surgery? So surgery always comes with risks like infection, blood clots, reaction to anesthesia, injury to blood vessels and nerves. So all those are complications that need to be discussed. Also, the recovery can take several weeks to months, during which mobility may be limited. Patients need to be aware of this before they go in for the surgery. In some rare cases, the surgery may not fully resolve the symptoms, or it could actually lead to new issues, things like stiffness or injury to the vital structures around the foot. So that's all we had on the treatment of flat foot. So flat feet are very common, and while they don't always require treatment, in fact, many times they don't require treatment, it's important to address the symptoms that impact the daily life. So whether it's through supportive footwear, physical therapy, or in rare cases where surgery is needed, there's an option to help feel more comfortable and stay active. So thank you for tuning in today, and if you found this video helpful, don't forget to subscribe, hit the notification bell, and comment down below. And until next time, keep it on Little Growing Bonds.